We use our knees every day to walk, to run, to jump.
How can we determine what activities were affecting Bronze Age knees? Hi, I'm Angelique, and I'm a rising junior at Boston University, where I'm studying biological anthropology and archaeology.
My name is Janeth, and I am a rising junior at the University of California, Berkeley, majoring in anthropology and minoring in disability studies. This summer, we participated in a research experience for undergraduates funded by the National Science Foundation completing bioarchaeological research.
Bioarchaeology is a subfield of anthropology that focuses on the study of skeletons and associated materials found within an archaeological context. Working with humans is a privilege. Studying archaeological skeletons allows us to learn what types of activities, diseases, or trauma a person or group experienced. The bones we researched come from two tombs called Unar 1 and Unar 2, located in the Emirate of Ras Al Khaimah in the United Arab Emirates. Unar 1 dates from 2400 to 2200 BCE, and Unar 2 from 2300 to 2100 BCE, both from a time period called the Anar.
Both tombs are divided into several chambers with inner walls. However, the purpose of such divisions is unclear at this time. These tombs are commingled, meaning that after multiple individuals were placed in the tomb, their families moved their bones around, mixing up the skeletons. Therefore, it is no longer possible to determine which individual the bones came from. Additionally, some bones have been partially or fully cremated, and many are also fragmentary. All of these circumstances can cause limitations in the assessment and interpretation of research.
The focus of our research was to investigate how activity patterns within this period influenced a bone called the patella. The patella is part of the knee joint and is commonly called the kneecap.
The patella can reveal a lot about the types of activities and the life history of a sample. Its size and density makes it one of the best preserved bones. The patella is a sesamoid bone, which means that it is embedded in the tendons around your knee. Tendons attach muscle to bone. Ligaments connect two bones. One tendon attaches at the top of the patella, and a ligament attaches at the bottom. These attachment sites are called entheses, and when the knee is put under stress, the enthesis changes. So, these enthesial changes can be used to shed a light on activity patterns. We evaluated each patella for bone growth at the attachment site as well as porosity.
Stress placed on the knee can also lead to pathological conditions or diseases such as osteoarthritis. This condition is the result of cartilage in a knee joint deteriorating until the patella comes into contact with the femur. We looked at the articulation of the femur and patella and scored for the presence, degree, and extent of lipping, porosity, eburnation, and other unusual pathological conditions.
We also examined the patellae for the presence of vastus notches. A vastus notch is a variation in the appearance of a patella where one corner is curved rather than straight. We observed the top outside portion of the patella and scored it as present or not present.
We hypothesized that there would be differences in the presence of enthesial changes, pathological conditions, and vastus notches between Unar 1 and Unar 2.
After we collected data on all 711 patellae from both Unar 1 and Unar 2, we performed statistical tests to determine if our hypotheses were supported or not. We found no differences between the tombs in terms of enthesial change or vastus notch presence. We also found that there were no significant differences between the sites for any conditions. However, we did find that patellae in Unar 2 were around 2 to 3 times more likely to have evidence of osteoarthritis than those in Unar 1. Additionally, the only example of severe osteoarthritis we found came from Unar 2. The Umanar period featured growing sedentism and oasis agriculture. Growing and harvesting agricultural plants like the date palm and building fortification towers along with other daily demands all place stress on the knees.
The higher presence of osteoarthritis in Unar 2 suggests that Unar 2 could have been used preferentially to inter a group that experienced more strenuous demands on their knees, perhaps because they participated more in agriculture. However, as older individuals tend to develop osteoarthritis, it's also possible that the group interred in Unar 2 lived to older ages.
We also found relationships between conditions of the knee. Within our UNAR-1 sample, patellae with enthesial changes are 2.5 to 5 times more likely to have osteoarthritis. Since enthesial changes and osteoarthritis can both be a result of repetitive and stressful movements of the knee or old age, it is not surprising that they co-occur at a high rate.
In addition, in UNAR-1, right patellae are 2.5 times more likely to have enthesial changes if they have a vastus notch. In UNAR-2, all patellae, both left and right, are around 2.5 times more likely to have enthesial changes if a vastus notch was present. It's unclear if vastus notch presence is genetic or caused by stress. If it's caused by stress, like enthesial changes, it may suggest that people in UNAR-2 had more mechanical stress placed on their patellae. However, if vastus notches are genetic, it could be that the individuals with them were kin who participated in similar weight-bearing behavior.
These results suggest that differences between the tombs did exist and that they may have been related to length or intensity of activity. Further research should explore the effects of age and sex on these factors. We would like to thank our research mentors, Dr. Carolina de la Cova, Dr. Jesse Goliath, Dr. Molly Zuckerman, and Dr. Leslie Williams for advising our research methods.
We would also like to thank our program directors, Dr. Leslie Gregorica and Dr. Jamie Ullinger, for their diligent work and guidance. Our gratitude also goes out to the National Science Foundation for funding this research.